Austin and now Texas chapter of Physicians for Social Responsibility. As a leader there, she has advocated for policies to reduce air pollution and climate change, worked to increase healthcare access, and launched the first environmental health elective at UT Dell Medical School. She was diagnosed with multiple sclerosis in 2009, so Dr. Doggett is also active with the National MS Society as a South Central board member, an MS 150 cyclist, and a top fundraiser. She has written a memoir, Up the Down Escalator, A Doctor Navigates Disease and Disorder, about her transition from doctor to patient. Outside of work, Dr. Doggett loves to run at Lady Bird Lake, bike on the Southern Walnut Creek Trail, and tend to her plot at the Clarksville Community Garden. She also enjoys the Austin live music scene and traveling with her husband, Don, a pediatrician at Dell Children's Hospital, and their two teenage daughters, Ella and Clara. Dr. Doggett graduated with a Bachelor of Arts in Political Science from Amherst College. She holds a Master's of Public Health from the University of Texas Health Sciences Center at Houston, and a Doctor of Medicine from Baylor College of Medicine. She completed her residency in family practice at the University of Cincinnati.
Okay, well, let's go ahead and get started. I'm going to have to do this without my notes, so hopefully that will be okay. But I really am so delighted to be here with you all today, and I am grateful for you taking part of your weekend to join me for this important topic. I know that this is a really tough topic, and yet you all are in a terrific position to be able to do something about it. I imagine we're feeling all a bit depressed after some of the talks that we've heard today and yesterday, and yet this is really a chance for us to be able to talk about, how to take action, how to move forward. Some of you, I imagine, want to shout this at elected officials. You'll die of old age, we'll die of climate change. It's incredibly frustrating to see people that are able to make decisions and able to take action, and yet they're not doing what we know needs to be done. But at the same time, I think that we can mobilize to do some good. My goal today with this talk is really to help you kind of have some inspiration about how you can take action to kind of plant that seed of what you can do moving forward and inspire all of you to do something, to take those next steps. So I love this quote. I always wondered why somebody doesn't do something about that. Then I realized I was somebody. Fortunately, there are a lot of somebodies out there, and I believe that all together we can collectively really make a difference. Let me share a little about myself. I was fortunate to be born into a family with two amazing role models of public servants. My dad was elected to the State Senate of Texas 11 days after I was born in 1973. He served for many years in the Senate and actually now is a member of Congress. My mom is a national advocate for children and families. She actually served in the Obama administration. Both of them taught me about recycling, and I remember going to Ecology Action to take cans and newspaper long before it was curbside, and because they were just so committed to that. My mom, as I said, is a national advocate for families. She's actually done talks all over the world in that capacity. And my father is a huge environmentalist, really fighting to stop climate change at the national level. In the middle here, this middle picture is the two of them and some friends at a climate rally just a few years ago. So I grew up in Austin, Texas. And then I went off to Amherst College in Massachusetts for school. I studied political science and took my pre-med classes at that time. And then I came back to Texas and attended Baylor Medical School. After medical school, and I also did my master's in public health at the University of Texas at Houston to learn about really kind of how to talk about health and impact health on a broader scale than just seeing patients. I attended residency at the University of Cincinnati, and then I came back to Austin. And my first job was right out of residency was at People's Community Clinic, which is a clinic for people without private insurance in Austin. And what I learned in that job is that I really needed to be an advocate for my patients. I went on to serve as the director of the UT Family Wellness Center for many years. And again, this was a patient population that was, a lot of folks that were really struggling, didn't have insurance at all. Maybe they had Medicaid, they couldn't get in to see specialists, they couldn't get their prescriptions filled, and they were really struggling. And I, again, had to be their advocate. I had to figure out what needed to be done, take action to help them get in to see the specialist they needed to get the tests done, even with a lot of constraints. In fact, that ability to be an advocate for my patients was so much more important in many cases than the medications I prescribed for them, than the physical exam, certainly, that I would do. Being their support, their advocate was really, really where it was at. So what does being an advocate mean? I think it's really different when I'm talking about patient advocacy versus advocacy for climate change, but there are some commonalities, and these are 3 of them. So the first one is a commitment to change. And the second is a willingness to speak up and share that commitment. So if I'm talking about a patient, then I'm, going to be speaking out to say, you know what, this X-ray charge that the hospital gave you was too much, and I'm going to call the hospital and I'm going to talk to the radiology department and try to understand where that came from and speak out and try to make that change happen. And so that willingness to speak up is important. Of course, it's even more obvious when you talk about something like climate change. You have to be willing to speak up and share that commitment. And finally, an openness to increasing one's knowledge and understanding of the issue. And that's what all of you are doing today. You're all joining this conference in order to learn more. One of the things that I found somewhat discouraging, it's obvious, but it was still somewhat discouraging, was that when I was working with patients, yes, I could make a big difference for that individual and maybe their support circle and their family, but my impact was really limited to that individual. And so that was what kind of brought me to thinking about, gosh, maybe I need to, if I'm really wanting to have a bigger impact, what can I do beyond the exam room? The other thing that I learned is that traditional medicine's impact is small. So we know that traditional care is only about 20% has only about 20% of the influence on health outcomes, compared to social determinants of health, or SDOH, which is about 80% of the impact on someone's health outcomes. So what we can do in an exam room with our medications and our tests is really, really limited in terms of being able to help someone's overall quality of life and health. I also learned that I, as a physician or a health professional, am in a unique position to make an impact, because as health professionals, we are highly trusted. And this is an interesting survey that comes out every year from Gallup, looking at surveying the public to say, which are the most trusted professions out there? The highest rated profession, and this has been at least 19 years in a row, is nurses. Nurses are tremendously respected, rated highly consistently for honesty and ethical standards. Nurses are in an incredibly powerful position to make an impact. And physicians also are in a respected profession, number 2 on the list this year, and pharmacists not far behind. So health professionals tend to be very, very highly rated by the public in terms of trust. So our voices really matter. I wanted to do more than doing patient care. Patient care is incredibly important and impactful, but I really I wanted to do more than that. I felt I had a responsibility to do more as I kind of thought about social determinants of health and being an advocate on a broader scale. So I made a phone call, and I called Physicians for Social Responsibility. Before I made that phone call, I actually went online and started searching to see, where's the chapter of Physicians for Social Responsibility in Texas, so I can connect with my own state chapter. And I learned there wasn't one. And I called National PSR and I said, is there something wrong with your website? Because I'm not seeing the Texas chapter. And they said, we don't have one. And so I actually realized we, of course, needed one in Texas. Texas has incredible potential for solar power, for wind power, for sustainable energy. And yet we are the #1 emitter in the country for carbon dioxide. We have the biggest carbon footprint of any other state. I gathered a group of physicians, of nurses, and we formed the first chapter of Texas Physicians for Social Responsibility. It's been almost 20 years ago, but in those early days, we really just started looking at opportunities to go out into the community and have a presence to learn about. We started to learn about the issue, but we also partnered with environmental groups and started showing up. So we attended rallies, we did speaking events, we did educational sessions at the state capitol, we testified before the Texas Commission on Environmental Quality. Our strategy, and by the way, it is Texas Physicians for Social Responsibility. It is not just physicians in our organization. We welcome other health professionals. We've had many nurses involved over the years, as well as other health professionals. We had a dietitian on our board for many years. And we've really gathered together to educate and inform the public and lawmakers about the threats to public health. We are primarily focused on climate change, as well as other contributors like air pollution. We also work on food systems, toxic chemicals, and nuclear weapons, reducing nuclear weapons. Another issue that's always been close to my heart, as well as that of many of our board members, has been social justice. We, as physicians, know the incredible disparities in our healthcare system, and so we at PSR have made it a priority as well to speak out to increase healthcare access. We did a survey several years ago on access to mental health care and found it very inadequate in the Austin area. We've done a lot of writing op-eds, as well as, again, rallies and speaking events. So what have our successes been? You know, it's often hard to measure those successes, but I think over time we've really had some notable ones. We've done quite a lot to reduce or to increase the knowledge among policymakers, as well as the general public, on sustainable energy and the capacity in Texas. We've also done a lot around coal, stopping the coal rush, and we helped shut down several coal plants across the state. We've also done a lot of speaking and writing about climate change. The middle picture here is actually from one of my students who did an advocacy elective with me several years ago. She actually, as part of that 1-month elective, went and did a press conference with an environmental group, and she managed to get a terrific op-ed published in her local newspaper. She's from Galveston, and it just shows what an impact a student can have. We've also developed a course called Toxic Free Child. This is a course for families and mothers, pregnant women, who to teach them about toxic exposures in their home environment. And we've had nurses deliver that content and curriculum to hundreds of women in the Austin area. And finally, I think this is the success that I'm most proud of with Texas PSR, and that is that we have developed an environmental health elective that we are going to be offering for the 3rd time this spring at the UT Dell Medical School here in Austin. Recently, that elective has been kind of picked up and modeled and taken around the state, so that now 2 other medical schools, UT Southwestern and Baylor Medical School, are offering it. We're also in talks with UT San Antonio. As many of you probably know, I don't know what the curriculum for environmental health is like at OU Medical School or at the other health professional schools, but certainly at my medical school it was lacking, and even at UT Dell, which prides itself on being a progressive and innovative school, there was really no curriculum to speak of on environmental health until we developed this course. So I have not limited myself to PSR and environmental advocacy. I've kind of fallen into a couple of other areas of advocacy too. I know that was mentioned in the introduction that I was diagnosed with multiple sclerosis back in 2009. And this has been an opportunity for me to be an advocate for people with MS. In order to do that, I've gotten very involved with the National MS Society. I think getting involved with an organization that's already in existence is actually very, very helpful. I've been able to participate in the MS 150 bike ride from Houston to Austin. This year it'll be from Austin to College Station. And this will be my 4th year riding that ride. I've been joined by my husband and my mom doing the ride, and we're all training together to do it again this April. I've also been blogging for the National MS Society, writing about my experience as both a physician with MS, as a physician and a person with MS. And that's been a great way for me to also connect with others around having MS, which is certainly a bizarre neurologic condition. I've been able to lead a really healthy life because of work that the National MS Society has done. So I really kind of see it as payback when I'm able to help fundraise for them and support their work. Another area that I've been very active in is vaccine advocacy. As many of you are certainly aware, this has been this has been a critical issue during this year of the last 2 years, actually, of COVID-19, but especially this last year when the vaccine became available to everyone. I became a fellow with the American Academy of Family Physicians last April, and that's given me an opportunity to increase my knowledge of vaccines, but also to speak out so that I'm offering commentary. I actually combined my vaccine advocacy with my MS advocacy and wrote an article for the MS Connection blog about vaccines and people with MS. And I've been doing trainings as part of my work. I now work developing programs for people with Medicaid and Medicare around the country. And we've developed a vaccine hesitancy training for health professionals to help empower them to talk to people about their resistance to vaccines and help improve confidence in the vaccines. I think the biggest risk is inaction. And that's really why I'm doing this talk today is really, I want to help inspire you and help give you the steps and strategy to take action. Dr. Haley mentioned in his excellent talk yesterday, Catherine Hayhoe. She's quite an incredible person. And what she says, and she's an evangelical Christian and climate scientist, and what she says is the biggest problem is people who don't know what to do. And if we don't know what to do, we do nothing. Just start by doing something, anything, and then talk about it. So I would tell you, you may feel like you don't know enough, or you're too young, or you don't have the connections, or you don't know where to start. And that's all okay, but you need to make sure you do start somewhere, and you'll learn as you go, and you'll figure it out, and you'll be able to make a difference. I'm not sure if any of you know what this flower is, but it's called a passion flower. I think they are magical. And I think that one of the most important things to do when you start as an advocate is to figure out what your passion is. Think about what you care about, what drives you. Take stock of your strengths and your skills. Build your knowledge base, and that's what you're doing by attending this meeting. And look for opportunities. You don't want to go it alone. You've got to find your tribe. You've got to find those people that are going to support and sustain you and help be there with you. And you want to set goals. Finally, you want to be brave. I think that may be the most important thing to do. You also want to live your values. I think this is important for giving you credibility. Make sure that you're not a hypocrite, that you're actually carrying out the things that you expect others to do and help others to follow your lead. This is a picture of me at my little garden plot, which actually looks awful right now after a recent freeze. This was a few weeks ago, but this is my garden plot at the Clarksville Community Garden, 4 blocks from my house. The other things that I do, and I'll just share about 7 or 8 of them, to just reduce my own carbon footprint. Certainly I use public transit, bike, or walk. Recycle, I'm obsessive about that. I'm sure many of you are as well. Reduce air travel. This is a really hard one for me, but it's actually the most important thing we can do as individuals to reduce our carbon footprint. And actually, this was the slight silver lining in not being with you in person, is that I did reduce my carbon footprint by not traveling there by plane. I follow a plant-based diet. We've heard some about that in some of the talks this morning and yesterday. Choose renewable energy. We've got solar panels on our house, and certainly we and a lot of people in Austin. I don't know if you're able to do this in Oklahoma, but you're able to elect renewable energy as part of your electric plan with the electric company. And then we also have electric vehicles in my house. This has been a real priority for us to help reduce our fossil fuel consumption. And then just reducing consumption overall is important. So just being thoughtful about what you buy. Do you really need to have, you know, so many pairs of shoes? My kids certainly think that you do, but we try to reuse and share things and provide hand-me-downs and accept things that are used. And just even when we buy things, look at the packaging to make sure we're not supporting companies that are overdoing it with the packaging. And shopping local is important. And I'm sorry that you can't see that. It's not popping up very well on the screen, but trying to support local business, and also that reduces the carbon footprint of the transportation. If you're getting something shipped from China, that's quite a big carbon footprint that it has just getting to you. But of course, individual actions are not enough. So we can do all of these things and we can get everyone around us to do all of these things, but it is definitely not enough, not nearly enough. We need much, much bigger action. We are small in our ability to make an impact as individuals, unfortunately. So here are some advocacy strategies that I would propose and encourage you to think about. You know, I think getting involved with organizations that share your values and your vision is really, really important. You can learn about these organizations by word of mouth. A lot of times at universities and colleges, there are certainly groups that you can get involved in. I think that's really powerful. You know, you can search on the internet, and you can also start your own, as I did with PSR. And with PSR, by the way, I didn't do it completely by myself, right? I contacted the national organization, and they were able to provide quite a bit of support in starting our own local chapter. So I'm not sure how this is going to work. This is a video of my friend Heather Falvo, and I don't know if the video is going to play. I'm going to start for a second, and then I may need to try resharing the screen with the sound. But let's see what happens here.
Hi, my name is Heather Falvo, and I'm trained as an intern.
Could you hear that?
Yes, we can hear that.
Awesome. All right. Let's go again. Oops.
Hi, my name is Heather Falvo, and I'm trained as an internist, and I practiced for many years in Austin and the surrounding areas. I joined Texas PSR this past year because I was deeply concerned about the climate crisis and wanted to see if I could lend any action or expertise towards spurring progress in this area. As I was looking over my professional and personal life for the last 10 years, I saw that climate disasters had deeply impacted that. The first event that I recall vividly was in 2011 when I was serving as the medical director and the in-house physician for Dell computers. Many of their employees lived in an area to the east of Austin called Bastrop, and over the Labor Day weekend in Bastrop, they had just absolutely devastating wildfires that destroyed dozens of homes. In the following days, I had patients that would come into my office suffering from allergy complaints, respiratory problems, and asthma exacerbations. As we were speaking, I also learned that several of them had lost their homes and all their possessions, or their families had. We tried to assist in any way medically, but also through the company employee support channels. Following that, there was Hurricane Harvey in Houston, in which 4 of my own relatives were displaced. By the time they arrived at my home in Austin, it had been an 11-hour trip from Houston, which normally takes 3. Every roadway between the 2 cities was underwater. It was an extremely scary time. For the 11 hours that they were on the road, I had no idea if they were okay or if they were alive. And then this past year, my husband and I were displaced from our own home for about a week due to the Texas power grid failure. So it's clear that action needs to be taken, it needs to be concrete, and it needs to be swift. I'm happy to be a part of Texas PSR, and I thank you for your support.
I love Heather's story, just because I think it really illustrates how somebody can be, you know, she's doing great work as a physician, but she really started to see patterns in, you know, a lot of climate change impacting patients, and then even her directly. And she really decided that she was somebody, as Lily Tomlin said, and wanted to do something about it. She's joined PSR and been a great advocate on our board so far. So what are some advocacy strategies? What are some things you can do specifically if you're part of an organization to help have an impact? This is a picture of me actually lobbying at the state capitol with 2 other MS activists. And I think being politically engaged is a really big part of your job as an activist or an advocate, although it's not for everybody, but certainly those political connections are important. Pay attention to the news, read the newspaper, make sure I will say I even read the social media, the anti-vax website or Twitter feeds in order to understand the other side, because I am a big proponent of vaccinations. And I think being connected with the news, including the perspectives of others who disagree with you, is really important. You want to vote for sure and remind everyone else to do so. It's critically important that we elect leaders who are like-minded in order to reduce climate change and other issues that we care about. Get to know your representatives, whether that's at the local level or the federal level or state. It's very, very important, if you can, to get to know those folks. They have office hours, they have town hall meetings, you can go on lobby days with professional organizations or nonprofits, as I did here with the MS Society, and that's a great way for them to hear your voice. And finally, you can call and send emails, letters about issues of concern. I'm going to actually give you an opportunity to do that at the end of the talk. Other strategies, and again, these are not for everybody. You may just be like, there is no way I'm going to go to meet with an elected official. That is terrifying, and that's okay. That may not be for you, but perhaps you can send an email where it's not so direct. And I think that's really kind of part of this decision making around how you want to be an advocate, is figure out where your strengths are and where you're going to be comfortable reaching out. But public outreach and education is another really great strategy. You can do that through writing. So letters to the editor, op-eds, articles, that's something that I really love to do. And I think it's really kind of a great empowering experience to have your writing published in a newspaper. Attend rallies, just as we've done many times with PSR. Get involved with social media. You can do speaking events as well. Again, not for everybody, but it's a great way to make an impact. This is another friend of mine, Mary Beth Bennett, who is a first-year pediatrics resident at the University of Washington in Seattle. And I'd like for her to have a chance to tell her story. Hopefully this will work.
Hi, I'm Mary Beth Bennett, former board member at Texas PSR, now part of the Climate and Health Task Force at Washington PSR, and current pediatric resident at the University of Washington. 2 ways I've been able to advocate for climate issues outside of direct patient care are educating younger generations about climate issues and informing the public by writing opinion editorials. As a medical student, I developed a healthy environment curriculum for kindergarten through 8th graders that I was able to deliver to kindergarten and 1st grade classes at Austin ISD. Since then, I've also published 2 climate-related op-eds, including one last fall here in my new home city of Seattle about the health risks of indoor gas stoves and the many benefits of building electrification. I'm grateful to Texas PSR for leading in climate education and advocacy, especially among health professionals in Texas. I look forward to staying involved in this work throughout my career.
Mary Beth is an incredible writer. I've actually given you a link to her most recent op-ed, and she's done all of this while raising 3 kids and going to medical school and now residency. She's just made it such a top priority, truly an inspiration. So here's another hero of mine, and that is Dr. Mona Hanna-Attisha, who is a physician from Flint, Michigan. If you all saw the talk that my husband Don and I did earlier today on air and water pollution, we briefly mentioned her story. She was a physician who got involved with the lead crisis when lead was contaminating the water in Michigan. What happened, and some of you are probably aware of this, is that the city of Flint decided that instead of their prior water source, they were going to take water from the river, and they didn't upgrade the pipes with anti-corrosion control. The water ended up getting contaminated with lead, and Dr. Hannah Atisha noticed that lead levels were creeping up in the hospital where she worked. She did a search through their electronic medical records and started looking at seeing a huge correlation in the increase in lead levels, which was connected with the increase, the switch over in the water. She was very brave. She got some really bad press. People were calling her hysterical, saying she was an unfortunate researcher, denying what she was coming out and saying needed to be done, saying that she was wrong. And she ended up actually finally over time getting things to change. Again, I think this is a great example of a physician making a difference, being able to notice when there's a problem, being curious as to whether there could be a connection, and really going above and beyond to advocate on behalf of her patients and her community. This is my last video. Another friend of mine, this is Hassan Seed, who's a fourth-year medical student at UT Southwestern, and I'm going to give him a chance to tell his story.
Hey, my name's Hassan. I'm a fourth-year medical student at UT Southwestern and also a board member of Texas Physicians for Social Responsibility. PSR has been a great platform for having a voice on environmental health. Through it, I've been able to testify at a national EPA hearing in regards to deregulation of methane and volatile organic compounds. I've also had the opportunity to publish in numerous magazines and newspapers in Texas and nationally on climate and the climate crisis. Overall, I think it's really important that people hear physicians' voices when it comes to this issue. And I would say that I'm really happy that a lot of you are getting and staying involved on this issue, and I would encourage you to do so in any way you can, whether that be through PSR or otherwise. Thank you so much.
Hassan has also done just an incredible amount of great work as a medical student. I, as a medical student, couldn't do anything other than study, or I would have failed certainly biochemistry and cell biology. So I'm impressed with any medical student, including all of you who have organized this conference, because you're doing so much great work, and really being a medical student itself is very tough. But I wanted to just run over some of the common challenges that you'll encounter as an advocate. I think one of the most important challenges is unclear, unrealistic goals and strategy. Really trying to come together with whoever you're working with to be clear on what you're going to do, who's going to do it, and what success will look like for you. We're actually undergoing strategic planning right now for PSR as part of our process to kind of get clear on our goals and our plan moving forward. Funding issues. This is always a big one. Certainly, if you're working with a nonprofit, funding is a constant challenge. Lack of collaboration. So lots of people doing things, but not really talking to each other. And sometimes you can duplicate efforts, or you can also leave big gaps in what needs to be done. Competing priorities. Of course, this is a big one. There's always too much to do. And politics. Political issues, often way out of our control, can certainly get in the way and be a big challenge. And of course, time. We're all pressed for time. I'm sure you all feel that as students. So how do you address some of these common challenges? I think defining roles and responsibilities is really important. Again, just to make sure everybody's clear on what the expectations are. Set clear expectations, review and revise your goals and plan periodically. Things are going to change. You're going to have to adapt, and being sure that you have a process in place to do that is important. Protect your reputation and credibility. This is really key. We get asked sometimes in PSR to sign letters or to join groups that are advocating for things that are not necessarily well researched. And we have to be very careful to come out on the side of science and be sure that we protect our reputation, or else we're not going to be believed in the future. Finally, you want to set boundaries. So you want to remember self-care and don't try to overdo it. You don't want to burn yourself out. And be flexible. Again, you're going to have to adapt to change. Things will change, and you have to kind of move with where things are going in order to be most effective. So I'm going to ask you all to take out your phone, or you can just do this on a piece of paper. And I'm going to give you about 2.5 minutes to answer these two questions for yourself. Set a reminder, send an email, or make a note for yourself. So what are the issue or issues that you are most wanting to address? And what are the first two steps to take action? Oops. Here we go. I'm going to start this timer, hopefully. There we go. If you all want to put some of these into the chat, that would be fantastic, although you don't have to, but I'd love to see some of your thoughts. You've got one more minute. Yeah, I'm seeing a couple of great ones pop up in the chat. Please add some if you'd like. Great. Well, thank you for sharing some of the issues you all want to work on. This is just really encouraging to see. So I'm sure you can see some of these if you're looking at the chat. So income inequality and lack of access to healthcare, mental health of adolescents, homelessness in Oklahoma City, gender disparities, underage vaping and alcohol consumption, climate change and health disparities, equity of care for LGBT patients, reducing the predatory actions of large corporations on developing countries and disadvantaged communities. That's such a good one. Racial inequality in healthcare, promoting a safe and healthy workspace to ease anxiety of new graduate healthcare workers. Wow, that's a cool idea. Structural inequality among urban populations without access to sufficient resources for health or sufficient and consistent medical care, access to affordable health care, improving pregnancy outcomes, promoting use of solar panels, racial disparities in all aspects of public health, income equity, reparations, and integration of housing. Oh my gosh, like that's fantastic and so exciting to hear all of you working on those issues. I hope you'll think about the question number 2 as well. Write yourself a note. What are the first 2 steps you can do to take action? Specifically, like what organizations are you going to get involved with? Or maybe it's just sit down and do a Google search and then make a phone call. Maybe it's pick up a book and read about, an issue just so you start to learn more about it. But I think it's really, really important to figure out what you can do to take action. Thank you so much for sharing. So I want to end with this quote from Winston Churchill, which I just love. Success is not final. Failure is not fatal. It is the courage to continue that counts. And I really hope that you all will take the spirit of these words with you. Remember that change is hard, but you can keep up the fight. And I can't wait to see the impact of your work as advocates. Thank you so much. I'm happy to take questions, but before I do that, I'm going to share just a quick couple pages of resources. I have a handout where I've put all of this information down for you with these links. There's a great article on getting started from a student perspective. There are 2 articles on how to write an opinion piece or a letter to the editor. I have my contact information as well as the link for student PSR. There is a student chapter that's for people from all over the country. These are some sample opinion pieces by Texas PSR members, as well as letters to the editor. So you can kind of click on those just to get some examples. Many of them are about climate change. And then you can also take action right now. So if you go to, I don't know if anybody's able to cut and paste this into the link, I might try in a second, but this is also going to be on that handout that you'll get after the conference. You can sign up for PSR email alerts, and there is a really wonderful action item right now where you can go and write in your name and send a letter to your senators. PSR will do it for you. You just have to click on the link, fill out some information, and it's to tell Congress to invest in renewable energy and transition away from fossil fuels. So you can become an advocate immediately just by going to that link. Thank you so much for your attention. I'm glad to hear some questions.
Thank you, Dr. Doggett. That was amazing.
Thank you.
I actually got a direct message in the chat if you'd like to start off with this one.
Sure.
It says, you mentioned being inspired by your parents, but was there a specific event or experience that sparked your desire to work in social justice and combine that desire with medicine?
That's a great question. You know, I really struggled with making a decision about what to do as a career. I was a journalist in high school. I was editor of my high school newspaper. I loved journalism. I also considered law. I grew up in a family of lawyers. There are no doctors in my family, or weren't before me. So it was not necessarily an obvious choice. But I really put a lot of thought into kind of how I could make a difference. And I think it was just kind of lots of conversations, not like one specific thing, but lots of conversations, thinking about it, writing about it, that led me to choose medicine and healthcare. I think part of it was that I realized at the most basic level, we need to be healthy. Like if we're not healthy, if a kid's not healthy, they can't go to school. If an adult isn't healthy, they can't have quality of life, they can't work, they can't contribute to their community. So it just seems like the most basic need as human beings. And I really wanted to be able to make a difference.
And we have one more question. It says, what do you think is the single most impactful change each of us can make to mitigate the social inequalities exacerbated by climate change?
Wow, it's a great one. I would say that really mobilizing those communities, empowering those communities, getting involved directly with those communities. It's hard to do that as an outsider. So you need to partner with people who are of and from that community, speaking with them about what their priorities are. So you don't want to come in as an outsider and impose your views, but trying to find a community that is ready for change and help support them to do that is really important. I think getting people to vote is really one of the most important things that we can all do. There have been some great successes around the country. Stacey Abrams, who I actually knew back in college, she's an incredible leader and has done great work in Georgia. She's shown how grassroots movements to increase voting are effective. And I think that really making sure we get elected officials in place who support climate change mitigation strategies and reducing fossil fuel consumption is really at the top of the list of priorities. Anyway, lots to say about that, but it's a great question.
I actually had my own question that I wanted to ask.
Great.
You graduated from Amherst with a degree in political science, and I was just wondering about what transitioned you to go into medicine from there.
Well, I was fortunate at Amherst that there was no required curriculum, so I was really able to easily do both pre-med and political science at the same time. And I really saw that there was an incredible connection between health and health policy. Back when I was in college in the 90s, health inequities and lack of healthcare was a huge problem. It has unfortunately still continued to be a huge problem. And I just kind of followed my passion with political science, really kind of learning about how government systems work, how people think, how they make decisions. I think that's really helpful when I think about, policy now, just having that background. It's helped me be a more effective advocate when I'm thinking about policy change for climate and other things.
And I have one last question that I got direct messaged. Do you have any personal advice you'd like to give us as future healthcare providers?
Oh my goodness. Lots of, that's another really good question. I think certainly a lot of the things I've said in this talk, I would reiterate, live your values. You want to be sure that if you're a health professional, you want to be sure you're being healthy yourself. So make sure you're exercising, you're eating well. It's going to increase your credibility with your patients. You also, of course, as an advocate on climate change, you want to do all those things in your personal life to reduce your own carbon footprint. And then I think trying to look for opportunities. You can try to also figure out where your passions are. So try lots of different things. Try journal. For some people, journaling is really helpful that's what I love to do in order to help kind of sort out what your thoughts are. Talk to people who know you well, so they can help you figure out if you're struggling with like what you want to do next with your life or your career. I think that bouncing ideas off people who are close to you can be helpful as well. And I think just making sure that you kind of stay in touch with your core values and in choosing your career path, as well as other decisions that you make. Be true to yourself.
Thank you, Dr. Doggett. You've been amazing.